Well, this month is Heart Health Month, so it's fitting that we talk about cardiovascular disease. It is a #1 killer of both men and women, but are we making any progress in helping to reduce the number of deaths? Joining us now is Dr. Anjanette Ferris from UConn's Pat and Jim Calhoun Cardiology Center. Dr. Ferris, thanks for joining me.
Thank you for having me.
So let's talk about the heart attack symptoms. It's very important because they differ from men and women.
It's very important to know the symptoms. The classic symptom of a heart attack is clutching pain in the center of your chest. Pressure, it's described like an elephant sitting on my chest. But women will often present with atypical symptoms, so we may not get the classic chest pain. We may often develop shortness of breath or nausea, and so other symptoms may present, or we may have just a discomfort in our abdomen and we may ignore it, or we may perspire, or we may become short of breath, and we may not pay attention to those symptoms, and they can signify heart disease.
But you see, those symptoms could be premenstrual, those symptoms can be so many different things.
Absolutely.
And an example is my best friend's mother had a heart attack, had no idea. She's a nurse herself, had no idea.
Absolutely.
And then she kind of thought and said, I'm not going to go to the doctors, and it ended up being something very serious. What about this jaw pain, or what's that?
A lot of pain from the heart can be referred to the jaw. It can also be referred to the arm. So some people will develop arm numbness or arm pain. But some people, again, may not develop any chest pain. They may develop jaw pain or pain within the neck region. And I believe just any symptoms that are new for an individual. If you're going about your life and you find, well, I used to be able to walk up 2 flights of stairs and now I become a little short of breath after 1.5. Or I'm developing these funny symptoms. The best advice is to check with your doctor. It never hurts to ensure that something else is not going on. Of course, it can be other symptoms presenting with other processes in the body, but we want to make sure to exclude heart disease. It's the #1 killer of men and women.
We're mentioning unusual fatigue. I know it may sound silly to the person, but the doctors don't mind if you were to call the office and say, you know, I'm feeling this, and they could call and just set up an appointment. It's better to be safe.
The doctor would rather know what symptoms are happening, and I think it's best for each of us to pay attention to what our body's telling us. We may go in and we may do a battery of tests and we may find it's nothing. It may just be fatigue. But it may be a manifestation of heart disease, which is our #1 killer, and so we really have to be quite aggressive in the symptoms that we develop.
And have you found that a lot of people do go in and then they catch something quickly?
Absolutely, absolutely. Again, we're so busy and so harried in our lives, and we often ignore symptoms and attribute it to other things. Well, this must be something else. But really, when many patients will come in and say, hey, I've been just having some shortness of breath, I've been able to run, was able to run a year ago and I can't, and we'll do some tests and maybe an electrocardiogram, which is an EKG that we do that can give us some information about the heart, maybe abnormal, which may lead us to other tests. And so a lot of times things are caught. So it's important to get in and be seen by your doctor.
And so this leads to my next question. What is the latest research and treatments concerning all of this?
Well, we have a wonderful, the good news about cardiology is that it's an always evolving field, and we have a lot of interventions that we can implement at this time. One of the techniques, the key, first of all, is prevention. And so, again, getting back to prevention is going to be important, listening to your body to prevent a heart attack. But if we do have heart disease, there's a lot that we can do. We have many interventions that we can do, a coronary angiogram where we can look at the arteries of the heart if it's necessary, and we can open it up with what's called a stent. There are a host of interventions, and our medications now that we have help to reduce our risk significantly. So #1 is prevention, and second is making sure that you develop a relationship with your doctor so that you know what's available in techniques.
And before we go, free information, it's always key. It's always nice. There's a program, a free program. If people want to learn more about it, it's to help instill all this information and let other people know and women know about heart health. So it's invaluable. This is at the Health Center on Tuesday, February 15th, the day after Valentine's Day. And you can register by calling 1-800-535-6232. Dr. Ferris, it's always a pleasure.
Thank you so much for having me.